Hello, today I'm going to be wrapping an instrument pack. The pack that I have here is for SPAY. So usually the doctor, they would go by a certain order for instruments. So that's where we will put the instruments that the doctors use first, all the way to the ones that they usually use last. And usually it's by doctor's preference on whether we want to use specific instruments or not. So we're gonna start with the sharp blunt. So we would put the instruments where the handle will be on one side and then on the other side as well. And they need to be placed neatly. And then I put the Metzenbaum dissecting scissors and the Olsen Hager scissors right here. And stack, usually we would stack the instruments by size. And I have the two Rochester cotton waltz. I have the Alice tissue forceps. And then the cryo hemostats. We got 4 right here. The instruments aren't going to always stay perfectly, but as long as they're in order and they're neat, that is what the doctors ask for. Okay, and last but not least, the Kelly hemostats. Okay. And then I have 2 rat tooth that we usually put like this, so it'll fit nicely in the pack. And then I have my Adson Brown forceps and a needle holder. I mean, not the needle holder, the blade holder. And then we will have a SPAY hook. Once that is completed, we have 13 gauze. The reason why we have 13 is so that the doctor will know how many is used, and if there are any that are left, that will mean that there's a possibility that there might have been a mistake with the gauze being still stuck in the patient. So that's why we usually count just in case, so we know. We have 15 here, so a total of 30. And I have towel clamps. Now once this is completed, I put my first indicator strip, and I'll have 2 hand towels. Every clinic is different, but Banfield requires 2 hand towels to go on top. And once this is situated, I spread out the drape like a diamond. And then start wrapping, but first putting this flap on this side, putting a little bit of pressure because we want to have the pack as tight as possible. And then make a little flap. Have the flap so the doctor can open the instrument pack sterilely. And then once again, side by side. And last but not least, the last part, we just tuck in nice and tightly, like so. Okay, next thing we would have, let's see. Actually, I made a mistake. We need to have 4 towels. So let's go back. 4 towels inside. There we go. Nice and tight. That can't be autoclaved. All right, so I have that. And then we'll have an extra hand towel for the doctor to dry the hands, and we have an indicator strip to make sure that it shows that this is sterile. And the same thing, we'll wrap it the same way that we wrap the instruments. Have a nice diamond. as neat neat as possible. Extra tape. This was old tape that was left on. There we go. Perfect. And make it as tight as possible and tuck that in. There you go. And then the last step is to put the indicator tape, which will say that this pack is sterilized. I like to put a little tab right here so it's easier for the doctor to pull the strip off. And just wrap it around. And the last thing we do is to write what kind of pack it is, in which this is a ovarian hysterectomy pack, which is spay pack for short. And then write the date and my initials. And that's all.